Hey everyone. There are three types of nurses in Canada: licensed practical nurses, registered nurses, and registered psychiatric nurses. In the US, however, there are many more, and each type of nurse has significantly different scopes of practice. In this video, I want to specifically talk about the difference between a licensed practical nurse or an LPN and a registered nurse or an RN in Canada. In this channel, I talk about all aspects of nursing. If you want to learn more about nursing, consider subscribing as I upload a new video every week. Also, be sure to give the video a thumbs up if you found it useful, as it helps others see the video as well. First, let's talk about the general differences between the two and talk about information that is common knowledge, and then we will talk about some of the specific skills that an RN can do that an LPN can't. I will preface by saying that the LPN and RN role in general are constantly evolving, and this is never completely set in stone. Throughout the years, it has been well known that both the LPN and RN scopes of practice have been increasing steadily. LPNs have a diploma in practical nursing. To become one, you must complete a college track that consists of 4 semesters. This takes about 2 years to complete. To work as an LPN anywhere in Canada, you'll also be required to take a national licensing exam. Once you've passed this exam, you're able to enter the workforce. Because it requires the least amount of education and training, LPNs usually have to work with patients who are stable and uncomplicated conditions. To work with more complex conditions, you'll have to further your education and become an RN. An RN has gone to university either in Canada or an international equivalent. To be an RN, you must either hold a Bachelor of Science in Nursing or Bachelor of Nursing Degree. These can be attained through a college university program or a 4-year university degree program. A RN's education and training are significantly longer and more comprehensive than that of an LPN. They're trained as generalists, and by the time they graduate, have a comprehensive knowledge around a range of patients' needs and treatments. This means that RNs are better equipped for handling complex needs. They're also trained to react appropriately in non-routine situations. A RN can build on these entry-level skills and choose a specialization when and if you decide to do so. And you can advance your career and become an NP. Now, let's talk about the specific scopes of practices differences in 2021. Now, each province that you work in may be a little bit different, so make sure that you reference the most up-to-date agreement set out by your nursing union. This is to give you an idea what the differences may look like, so that you are able to make an educated decision which career you would like to pursue. Here are the main differences in scope of practice. Feel free to pause the video if you want to look at the specifics, but again, this is just to give you a general idea. This may vary depending on your state or province. The other factor that you may want to consider is the difference in salary. RNs do more education, and therefore the salary is impacted accordingly. They make approximately 30% more than LPNs. So, given these circumstances, you might be asking yourself, why would someone choose LPN over RN? Well, it is a great way to gain exposure to the healthcare field and see if it is truly something that you enjoy. The other reason that you finish school quickly, and the other reason is that you finish school quickly and are able to make a healthy income and work yourself to becoming an RN over time. Another reason is that hospitals or institution will actually pay for your school in exchange for a year or 2 years of work for them. So essentially, you can get your education paid, and it is not too rare to have that happen, especially in the United States. So in summary, the key differences are: 1. RNs make approximately 30% more than LPNs. 2. RN education is a longer and more expensive process than LPNs. 3. LPNs report to RNs in the professional setting. 4, RNs have more scope of practice in clinical settings than LPNs. So there you have it. Those are the differences between being a licensed practical nurse and a registered nurse. If you enjoyed this video, consider giving it a thumbs up and let me know if you want me to do a video on registered psychiatric nurses or any other videos in the comments down below. Thank you so much for watching this video, and I will see you in the next one.